Are you Miss Canapi? Good morning, ma'am. I'm Angelica, your student nurse today. Today I will assess your head, face, and eyes. First, do hand hygiene. Use clean gloves if necessary. Provide privacy by closing the curtains and closing the doors. Observe the size, shape, and contour of the skull. Observe scalp in several areas by separating the hair of various. Inquire about any injuries. Note presence of lice, nits, dandruff, or lesion. Palpate the head by running the pads of the fingers over the entire surface of the skull. Inquire about tenderness upon doing so. Observe and feel the hair condition. Ask the client to smile, there should be bilateral nasolabial fold. As sensory function or trigeminal. Ask the client to close the eyes. Close the eyes. Run cotton whip over the forehead, cheeks, and jaw on both sides of the face. Ask the client if she feels it and where did she feel it. Checking for cornea reflex using cotton whips. The normal response should be blinking. Assessing motor function, the client to chew or clench the jaw. The client should be able to clench or chew with strength and force. Motor function of facial, ask the client to smile, frown, raise eyebrow, close eyelid, and puff the cheeks. In accessing the eyebrow, eyes, and eyelashes, we use the modality of inspection in 3 aspects. In eyebrows, inspect for symmetrical. It should be in line with each other. Color may depend on race. Evenly distributed. In eyes, evenly placed and line with each other. Non-protruding. Has equal palpebral fissure. In eyelashes, color dependent on race. Evenly distributed, turn outward. In eyelid and lacrimal apparatus, inspect the eyelids for the position and symmetry. Position and symmetry. Palpate the eyelids for lacrimal glands. To examine the lacrimal glands, the examiner lightly slide the index finger against the client's lid orbital rim. Inquire for any pain or tenderness. To assess the nasolacrimal duct, the examiner presses with the index finger against the client's lower inner orbital rim at the lacrimal sac, not against the nose. In the presence of blockage, this will cause regurgitation of fluid in the pancha. In examining the palpebral conjunctiva, averting the upper eyelid is necessary and is done as follows. Ask the client to look down, but keep his eyes slightly open. This relaxes the levator muscle, whereas closing the eyes contracts the orbicularis muscle, preventing lid eversion. Gently grabs the upper eyelashes and pull gently downward. Do not pull the lashes outward or upward. These two cause muscular contraction. Place a cotton tip application about above the lid margin and put gently downward with the applicator while still holding the lashes. This exerts the lid, hold the lashes of the everted lids against the upper ridge of the bony orbit just beneath the eyebrow, never pushing against the lid for swelling. Examine the lid for swelling. Examine presence of foreign objects to return the lid to its normal position. Move the lid slightly forward and ask the client to look up and to blink. The lid returns easily to its normal position. Look up. Thank you, ma'am.